Today I'm joined on the weather patio by Dr. Takatka from the Helen DeVos Children's Hospital Congenital Heart Center here in Lansing. So welcome to the weather patio today. Tell me a little bit about your facility and what you do.
Thank you for having us today. It's a pleasure to be here. Our pediatric cardiology clinic has been in the greater Lansing area for the last 35 years. We joined Helen DeVos Children's Hospital back in 2007 to be part of a larger cardiac center. Currently we are 3 full-time pediatric cardiologists. We have daily clinics and we have coverage for inpatient services 24/7 for both hospital Sparrow and McLaren hospitals.
Okay, so tell me about the patients that you guys see.
We see a wide variety of patients, patients with congenital heart diseases, which are heart conditions that are present after birth, which can be something minor, like a small hole in the heart, or like a severe, like a missing part of the heart, which might require surgeries. Also, we see patients with general pediatric cardiology complaints, like chest pain, heart racing, hypertension, heart murmur, and so on. Another service also we provide here locally in Lansing is fetal echocardiogram, which is taking pictures of the baby's heart before they are born. So we are able to explain to the families what's going on with the babies before birth in order to take informed decision and help them understand and expect what's going to happen to the baby after birth.
Okay, and I'm sure there's a whole list of services you guys provide, but what are those services and procedures that you do for these children?
Correct. So it's like we provide several services like echocardiograms, which are ultrasound of the heart, electrocardiograms and heart monitors, which are devices used to measure the electrical activity of the heart, fetal echocardiogram, and stress test too.
And what are the ages that you guys service?
We see patients from, like, of course, fetal life before birth, and also we see children and adults also.
And I'm sure that the pandemic has kind of changed your operations a little bit. Talk to me about that.
Initially, it was like a little bit restricted, because of the pandemic. But after that, we are working now full capacity, of course, socially distanced, and we are taking precautions to serve the patients when they come to our clinic.
Okay, and what do those precautions look like?
We screen them first. We give them calls before they come to our clinic. We provide them with masks and hand sanitizers, and we try to accommodate patients separately, and we try not to leave them in the waiting area for long times.
Okay, and you guys are kind of a branch, an extension of an office to be able to serve people here locally in Lansing. Talk to me about that.
So we serve several communities locally, including Mason, Jackson, Charlotte, Eaton Rapids, DeWitt. Also, we get patients coming from Flint and Grand Blanc, and we have traveling clinics in Owasso and Mount Pleasant. So we are committed to provide high-quality healthcare services locally in Lansing. This would save families the long commute to get these services in Grand Rapids.
Save you some gas money at least.
Of course, yeah.
And Dr. Takatka, if people want to make a consultation or an appointment with you guys, what's the best route?
The best route is to get a referral from a family physician or a pediatrician, and we are able to accommodate them within 24 to 48 hours once we get the referral. And many times we can see them immediately in the same day if the case is urgent.
All right, Dr. Takatka, thank you for coming by the weather patio and imparting that knowledge to us. Thank you for your time today.
Thank you for having me.
And stick around, there's more to come on Studio 10.